I hope everyone is doing amazing. Welcome to another session with Having Coffee with Dr. Munné. My name is Adrian, and we have.
Hello, you know me, Dr. Munné. You can call me Anna also. Today we're going to be talking about oral hygiene. And I started the series this year emphasizing a lot prevention, right? Because we started talking about what's worst that could happen for
What
the year,
happened?
and that was to
Yes.
lose a tooth. And we talked about reasons, of dental disease and ways of preventing, dental disease. And today we're going to talk about one of them, which is oral hygiene. And I think that is important first to realize why we have so much still decay and so much periodontal disease. Well, I know that we all brush and hopefully we all go and see the dentist. Nonetheless, we still see that you go have like a cavity done and they do the cavity years later. There's recurrent decay on that cavity again, and then you got to go and get like a bigger filling, and then the next time, a couple of years down the road, that becomes a root canal or a crown. And here we go until the tooth is lost, right? So same thing happens with gum disease, right? Patients that have gum disease, they do have pockets, and then those pockets, which are areas of bone loss, they brush and they go to the dentist, but those pockets still getting bigger. Well, those two things I'm focusing today, which is decay and periodontal disease, those both are bacterial diseases. And I'm going to focus today only on bacterial diseases because bacterial diseases can be prevented, right? Because we know how to, act in the presence of bacteria. So this is something that really got down well. We cannot change certain things like the patient's genetics. We cannot change the genetics. We cannot change certain factors, but the bacterial factor is changeable. That is something that we can do by different means. One is by brushing thoroughly, and number two is by having regular dental cleanings and checkups at the dental office. If those two things are done, encompass in a way that it prevents the bacteria 100%, we should not have any bacterial diseases like decay and periodontal disease. So actually, the fact that there's still so much dental disease caused by bacteria like decay or caries and periodontal disease, or gum disease, however you want to call it, that's because we have not tackled the prevention well. And that's what I want to make sure that today we're going to talk about how to brush. And that's going to be very important that you do that very thoroughly. If you do that very thoroughly, I guarantee you that your mouth's going to change and you're going to see the changes because I sit in my office day after day, once the patient really realizes what needs to be done. And sometimes it takes a while to click, it's not something that happens immediately, because we do oral hygiene instructions to all our new patients. And still, when they come, I can see that there's still inflammation, probably still some plaque that I can visually see. Sometimes there's still pockets that recur, and they go, well, doctor, I'm doing everything that you say. And I know that they're doing, but then when we do a demo and we see what the patient does, and then when we show them in their mouth, they go like, oh, that's what you meant. So, it takes a while to actually get the results that you want and getting better at it. It's like working out, right? You might do an exercise, but then your trainer is going to tell you, well, you need to, step more forward to
That's
get
right.
the full effects. So that's the same thing. Your doctor is your coach or your hygienist or your dental team. They're your coaches and they're the ones that are going to help you on tweaking. And you can always call us and send us a video and we'll be happy to tell you if you're doing it right or not. But what I'm going to show you right now, I want you to practice it, and you can repeat this video over and
That's
over
right.
until you have gotten it and you do it 100%. So this is going to be my model today, and I'm going to show you, I'm going to try to get a little closer, and I'm going to show you exactly how you should use your toothpaste, your brush, your toothbrush, and the technique. That's going to be very important. First, you're going to start with a bristle brush that is soft or extra soft. I'm sorry, I picked up a white toothbrush, and everything is white here, so behind my white coat. But you want to make sure that it's extra soft or soft. You're going to use your toothbrush dry. Don't wet it before. It just foams a lot. It just makes you gag. So you don't need any water. Your mouth has plenty of moisture. So you're going to apply only a little bit of toothpaste, like a pea size, just like a little pea size. You don't need to have a lot of toothpaste, on your brush. It's just not going to help anymore. It's going to make a lot of foam. You're going to need to spit out in the middle. And the trick on brushing correctly is going to be to brush a long time. You need to do that until the whole bacteria load is removed. And that takes like about 10, 15 times. And you're going to go, oh my gosh, who brushes 10 to 15 times? Well, a lot of people now brushes 10, 15 times. 10, 15 minutes. 10 to 15 minutes. I brush 10 to 15 minutes for the day, and a lot of my patients do too. Hopefully all of them. But the ones that do well, they do. And they do well because they do brush a long time and they remove all the bacteria. And when you're brushing, remember that you're not removing food. That's not the goal. You are removing food, obviously, but that's not the goal. The goal is to remove bacteria. And bacteria is invisible. You're going to remove all the food, and you can still have gum disease and decay, because if the bacteria is still left behind, that's what causes the gum disease. So when you are brushing, you're brushing to eliminate bacteria, and that you're not going to see. So when you think it's clean, you're still going to continue brushing because there's still bacteria that you're not seeing. So how are we going to brush? We're going to hold our brush like a pen, not like a hammer. Okay, we're going to hold it like a pen, so that way we're going to be applying less pressure. And another day we'll talk about how to use electric toothbrushes, but not today. Today we're going to focus on the manual brushing. You're going to start on the same place always. It doesn't matter, you start in the top and the bottom, the right, the left, but always start in the same place. I always start brushing inside the mouth, in the bottoms, because that's usually the place that everybody misses the most. So that's where I usually start. But I'm going to show you now here in the model, because it's going to be easier to see here in, Mr. Toothy, how we're going to brush. So we're going to place our brush. We're going to place it to the side of the tooth. I don't know if you can see, but it's just, perfect. It's to the side of the tooth. And then I'm going to give it a half circle down. So I'm going to place it to the side of the tooth and then half circle down. So it's going to be like a half circle down. You're going to make sure that it touches the gum, and then you're doing tooth by tooth, one tooth at a time. So you're going to go and you're going to focus on the very last tooth, and that tooth is going to have 15 strokes. You're going to place it sideways and you're going to go down. Tooth by tooth, one tooth at a time. Okay? Here, tooth by tooth, one tooth at a time. Once you're done on this one, you go to the next one, and you're going to go down, tooth by tooth, one tooth at a time. This type of brushing is not going to cause gum recession, and is not going to cause tooth wear either. So you want to go down. Never brush sideways. Some patients say, well, I use a circle technique. Well, the circle technique is perfect if you have an electric toothbrush, but if it's not a perfect circle, what patients end up doing is doing this, a big circle. So it's basically like brushing sideways and turning down, right? It's like a big circle. So unless that you have an electric toothbrush that can make a little circle on the tooth, just don't do the circles. You just do down, and on the bottom, you're going to go up. Okay? And you're going to do this tooth by tooth, one tooth at a time, 15 times each tooth, tooth by tooth, one tooth at a time. So when you brush, it's not like you're brushing all these teeth like that. No. You're focusing on one, and then you go to the next one, and then you go to the next one. That's very intentional, and
Mm.
that's what really is going to eliminate the bacteria. Remember, that's what we want to eliminate. Then on the chewing sizes surfaces, you can do this. And the biggest problem is that usually my patients do excellent job on the outside of the tooth. So all these areas, they look fantastic. All this fantastic. Then when we go inside the mouth, that's where the problem. That's where there's inflammation, there's redness, there's bleeding. And always the problems are in between the teeth or on the back side.
Mm.
Why? Because we're not as thorough there. So that's why I personally start brushing in the lower here, because that's where the tongue is. And it usually bothers us more to brush there where the tongue is. So I always start brushing here, and I'm going to go up. So I'm placing the brush sideways, and I'm doing a half circle up, and I'm going to make sure I touch the gum. I want to make sure that gum is clean, because that's
Mm.
that area between the gum and the tooth, that's where all the bacteria goes down. That's where you want to keep really clean. And we're going to do 15 strokes up on the bottom and 15 strokes down on the top. 15 times, tooth by tooth, one tooth at a time. You're going to do that, and you're going to rinse out, and your teeth are going to feel like you just had a dental cleaning by the best hygienist in the world. And if you do that every day, you do that twice a day, I can guarantee you that your mouth is going to change. And today we're only going to talk about this, and I want you to practice it, and then we're going to build up on that. So we're going to every day learn a little more.
All right, thank you guys so much. Thank you, Dr. Munné. This was great with this prop with Toothy. Thank you for bringing some good props that we can see clearly on how to take care of our teeth. Please don't forget to like us on our social media. We are on Facebook, TikTok, Instagram, YouTube, and go to our website. If you have more questions, Healthy Gums for all. Do not forget that the number four, and we're here to help you achieve all your dental goals this year, 2026. We'll